Thank you very much, Emma, for having me.
You're very welcome. I'm very happy to be sitting with you today and very grateful to Skype for allowing us to have a clear contact. Uh,
Exactly.
Dr. Pradeep, would you please, are you referred to as Dr. Pradeep? People do that in Brazil. Would you prefer Dr. Chadha or can I call you Pradeep?
Well, you can call me Pradeep,
Okay,
but my clients call me Dr. Chadha.
thank
That's
you.
fine.
Okay, thank you. Please let me know what it is that you do in Ireland. I know you're a psychiatrist, but you also describe yourself in different ways, as well as being an author. So, would you give us an introduction?
Okay. Many years ago, when I came into business, basically, I learned from a gentleman called as Professor Ivor Brown, who is very old now. He's Professor Emeritus of University College Dublin. I happened to work with him, and I saw hypnosis for the first time. Hypnosis that that was effective, and that was 91.
Hmm.
And I became curious, so I started to ask him questions, and his answers were very simple. He said he didn't know much. He just simply knew one or two techniques of hypnosis, and that worked very well with him. But I could see he did great work with people with borderline personality disorders, with a lot of abuse cases, and he used to do what was at that time, as I knew, hypnosis, but he probably used holotropic breath work.
Ah,
But he never used the word hypnosis because hypnosis is still a taboo word in psychiatry.
hmm.
And when I became curious, I started to look for answers myself. As he told me quite bluntly, I know this much as I do, and that's all. So he was very honest. So I started to explore myself. And in the exploration, the first thing I had to explore was who was going to teach me hypnosis. And there was no medical person to teach me hypnosis like the way I wanted to learn. So
Yes.
I learned hypnosis from a layperson. I did a full course, trained myself. It was psychoanalysis, hypnoanalysis, that was what it was called. And then I set up my own practice in 1996, and I called myself at that stage drugless practitioner, drugless psychiatrist.
Ah,
And very quickly did I learn in my practice that I had skills of prescribing drugs, so I knew how drugs worked. So I could start helping people come off drugs. And then I started to do that. So when people would come in with anxiety, depression, post-traumatic stress, OCD, I helped them come off medication. And I've seen people with 4 or 5 drugs, and they have successfully, some of them have come off medication.
mm.
But it intrigued me as to how things worked. And then I discovered something very interesting. I discovered that the body physiology works in a very particular way. The whole game of depression, psychiatry, OCD, and everything that you can include, the first thing that happens is a disturbance in the autonomic nervous system.
So, Dr. Chadha, I would like to say, just for this introduction, I'm happy to let people know that you're located in Dublin, Ireland. And
Correct.
I'm thinking that since this goes all over the world, there may be people coming to you from all over the world.
They are more than welcome.
Oh, that's wonderful to hear. Now, I know you have a lot to tell us, especially about depression and anxiety and the new book you're about to release tonight.
That's
So
right.
I'd like to stop our introduction here, and then we'll go on in a longer talk in just a moment.
That's
Thank
great.
you so much.